Hello everyone. This presentation is on Tangui Liu Quan Tang, also called Tangui, and 6 Yellow Decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Tangui Liu Quan Tang is classified under stabilize and bind. A representative pattern is yin deficiency fire with night sweating. Important ingredients include Tangui, Sheng Dai Guan, Shu Dai Guan, Guan Lion, Guan Qin, Guan Bai, Guan Kai. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 55-year-old woman with night sweats, diabetes and rheumatoid arthritis. The current medicines are metformin, methotrexate, apixaban. This case gives a plausible reason to consider Tangui Liu Quan Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Tangui plus apixaban. The mechanism is Tangui may add to anticoagulant effects. The clinical significance is moderate. My management plan is monitor bruising and bleeding and avoid other blood-thinning supplements. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Guan Lion/Guan Qin plus drug metabolism. The mechanism is COPTs and scutellaria can alter CYP enzymes and transporters. The clinical significance is potentially important with narrow therapeutic index medicines. My management plan is pharmacist review is appropriate before combining with complex regimens. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Guan Kai plus immunosuppressive therapy. The mechanism is astragalus is immunomodulatory and may conflict with intended immunosuppression. The clinical significance is uncertain but clinically relevant with methotrexate or biologic therapy. My management plan is coordinate with the treating rheumatology team. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Tangui Liu Quan Tang may be reasonable when the patient's presentation matches yin deficiency fire with night sweating. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.